Hi, I'm Dr. Boncheol from Classes. I'm a Chief Medical Officer of this company. I'm very happy to introduce you the Ultraformer 3 and body contouring treatment with utilizing this Ultraformer 3. It's quite new and I'm very excited to introduce this technology to you. High-focused ultrasound, aka HIFU, is making ultrasound the focused way inside of the skin usually, and it makes coagulation done in a very precise way, and you can design the pattern inside the skin to make a change of the skin or even below the skin, I mean the subcutaneous fat tissues and other kind of muscular layers and mass layers of the face. So it makes a differences in between before and after. You can see differences by arrangement of the matrix bundles and arrangement of other kind of fibrous tissues, and also decrease of the volume of the fatty tissues and the matrices. So it's very versatile, and you can utilize this machine or this technology using variant options for different kind of depths. So you can just achieve a much more better improvement from the texture to the body contour. There is no specific contraindication for Ultraformer 3 other than the other energy-based devices. Like any mechanical implants on the skin can be reached from the surfaces or other kind of skin infections of any types. But there are some precautions that we have to be aware of. For example, anticoagulant therapies should be discontinued before the treatment, and other hypersensitivity tendencies or other kind of systemic illnesses that can affect the treatment result, and the safety should be checked before the treatment. Because Ultraformer 3 offers very precise reaching depths, it is very easy to check the nerves in the bony areas we have to avoid. For example, mandibular branches of the face or any condyles in the arms or umbilicus in the ribs and the crest in the abdomen treatment, or patella we are treating the above and the lower, the knee parts. So great to see you today, and we will find out the best way to make your, even you are already beautiful, but we will make you a little more beautiful. Okay.
Awesome. Yes.
Okay. So, can you tell me about your discomfort? What I mean is any kind of a problem you can ask me to solve.
So I think my trouble area currently is my stomach.
Stomach.
I think maybe I'm eating a little bit too many carbs.
Fortunately, the procedure we are doing here is making some of the concentration for the any kind of energy device to make a better shape for the specific kind of site. Any kind of chubby area, like arms and armpits and other kind of necks or something, or whatever. So
Right.
yeah, so maybe if your priority is your belly, maybe we can just go for another kind of a shape, like a vertical kind of lines, maybe, or we can just decrease the volume in a proper way, so we can start with that.
Okay.
So now we are going to start our strategy meeting together and to make a better treatment safely and effectively. So we are making design some of the pictures and then your body. You okay for that?
Yes, that
It'll
sounds
be so
great.
fun.
Yeah, I think so. Awesome.
Okay, great. Shall we go then?
Okay, let's go.
Great. Okay, great. We are starting to measure. Now we are going to the target area.
Okay.
Yep. If it is exceeding some of the numbers, we can start our treatment, and we need to select proper depth to make a fat decrease.
Okay.
Okay, so another way to do, okay, great. So we will measure the point by point. Great. And we'll make a design part here to make a marking here.
Okay.
Okay, great. Okay, so great. Any other place you want?
Maybe on my
Okay, then.
under my arms.
Under my arms. Can you put your arms like this?
Yes.
Okay, then. Great. Okay, if you want to make another kind of lesions, if you want to treat.
Maybe in this
Oh,
area.
yeah, this area, yeah, quite trendy area. Okay, great. Maybe it is combined with some of the drooling or the decrease to the elasticity of the skin, so we can combine the tightening and some of the shaping together.
Okay.
Okay, so this area is getting some of the volume decrease, and maybe if we can extend, this kind of area can be added for tightening. And also, if you want, maybe we can just add this region too. And there is some of the asymmetric kind of distribution of fat around your knees. The left and right is a little bit different, so we can make a different kind of approaches for them.
Okay. Awesome.
Great.
Thank
Okay.
you. Yes. Number 3, please. Number 3. Yep. And finally, number 4. Easy.
So now we are going to check some of the points that we have to take care.
Okay.
Yeah, there are some kind of points that the nerves, they're running superficially, or some points that you can feel pain much more easily. So we can check the guiding point. Okay, then?
Sure.
Yeah, for this area, we need to check the lips, of course. And we have to check around the umbilicus. And some of the bones, we can just cut it here. And when we are checking this area, when we are finishing these kind of muscles, nerves coming through this way, and nerves coming through this way. So we are cutting this kind of safety area. So we will just play on only this area. Okay, great. So, and another way for this is quite the safe area, but still we don't need to touch this bone. Actually, this bone is different person by person, so
I see.
to check the bones. Okay, now we set down the treatment zone and the danger zone, so we can go for the treatment very, yeah. Record. 많이 써봐야지. 붓을 쓰는 것도 한번 봐줘야죠. 오케이. 시작해볼게요. When you are going for this kind of round area, please check the right angle direction, like this way, not on this way, because if it is not contacting the skin barrier, it make a coagulation point wrong depth. It will make a pain or complication here. Usually I use my left fingers to make a proceeding kind of measurement. If you are checking this area with the fingers, and if it follows with these fingers, maybe we can just check some of the bone points and some of the danger points, and some of the other kind of if there is something inside the skin, maybe we can just make a like a scouting kind of action. So we can just go for the treatment in this way or in this way, and we are checking in this kind of movement. Maybe we can just find another way, better and safer ways. I'll just make some self comments, and usually this is my style of the treatment, but when I treat the treatment, usually I go for the bellies with the vertical lines. What I mean is, there are some of the muscles going for the six packs or other kind of shapes. Usually the lines that people can feel beautiful is almost vertical. So making the division for the muscle arrangement, we are going for the more treatment on the on the valleys. What I mean is valleys is the concave areas between the muscles. So we are going for another kind of a treatment for the valleys. So total, the number of the passes much more focused on the valleys, then make a better shape for the vertical lines of the valleys. The coagulation point or coagulation zone of this 9mm is quite large bore. So you can just make a treatment if you are going for higher energies. Maybe we can go for the wider sectors of the differences, but you can go for if you are going for the much lower energies, maybe you can just go for the overlap. Okay, great. Now I'm spreading the skin a little bit and make a contact, firm contact, but not pressing down. Because in a supine position, usually it goes down with this way. So the patient is continuously breathing. So if we are just make her the rhythmical kind of treatment, that will be better, but it is not always easy. So usually we are just spreading the skin for the very constant kind of the planes, and make a firm contact and not pressing down. That will make a much more constant the changes inside the skin. When you are treating the larger hand pieces with the larger surfaces, usually these kind of larger surfaces, you need to take a much more firm contact with the right angle in the right direction. So you can just go for this. Unwanted volume here. Something that we have to consider is the running of the nerves from the brachial plexus to this ulnar nerve and the radial nerve. Usually the radial nerve is crossing the opposite ways, and it is going deeper. When it is crossing the skin, goes down deep. So usually it doesn't matter. But the ulnar nerves go for this crossing the epicondyle superficial area. So when you're crossing and when you're colliding, sometimes it feels like lightnings. So using the safety area, 5 to 7 centimeters, conservatively or 10 centimeters, we are making the kind of lines here. And the end of the deltoid here for this, and if you're going round this way, the slender person can have a brachial plexus and a much more superficial location of the nerve here. So we are making the treatment only this area. And this position is very useful to make a comfortable kind of treatment for the patient, because if you are lying on the supine position on the back down, we can make this kind of this stretching. Usually the distance in between the skin and the nerves is getting closer, and the area can be a little bit discomfort for this area. So when we are moving this, we can make use the gravity here and make a rotation up this way, and the treatment. Shall we start for this? Okay. You can round up like this, or you can pinch. Either way you can treat, or you can just make this kind of ways. Okay. But usually this position is not always available for the chubby person. Because I need to use my longer fingers to pinching and rotating like this. And if you are going for another way of the treatment, because this one is quite convex kind of a volume, like over and cylindrical. So basically the most of the volume contains in the center. So maybe we can just go for another way. In this area, we can pinch a little bit more and pressing down. Sorry, I'm squeezing a little bit. Do you feel okay?
Yes.
Great. Because it's relatively small area, so we need to take care. The right angle is very important, especially. This area is quite safe, but if it is just handling over like this, maybe you can just hold this tip as to make a firm contact. So your left hand can be a guide, or can be a fixer, or can be a other kind of braces or accessories. Okay, we are going for another passes for this area, because when we are getting AIDS, usually the large area of the skin elasticity is decreasing. So skin tightening, as well as the deeper tightening, is quite very good combination option for the better shaping textures. So we are going for another depth with a 4.5 millimeters. Sometimes it can be useful for the elderly person with a 3 millimeters, but we are going for this way. This is the actual shot. Fake shots. So after the treatment, immediately we need to check some of the points. So sometimes immediate swelling can happen when we are damaging the small vessels, so we have to check it. And if there is some kind of a discomfort, like dysesthesia, or the sense discrimination is disturbed or something, maybe we can check for the with the conversation of with the patients. And if there is nothing remaining and everything is perfect, we can just erase the area, and maybe we can just go for the different kind of movements, like flexion of the knees, or make bending the bellies, some of the very simple kind of movements. I will tell you about something we have to take care. Very simple, but just a few days. Today, you can feel a little bit numbness sometimes, and you can feel a little bit swollen kind of feeling. but that's all. So if you the redness or other kind of a visual kind of symptom persist for days, more than 3 or 4 days, please contact me.
Okay.
Okay.